To keep with the theme of growing internationally, I was able to invite one of my friends, Professor Chaim Lotan from Israel. And I've known Chaim now for over 5 years. I got to know him because we kind of worked together to start an innovation workshop there at his conference, which is IGI, that's Innovations in Cardiovascular Interventions, which he started over 7 years ago. We started that workshop there. It was so successful that we copied it here, and we've done it here now for the last 3 years. And I was finally able to convince him to come and give his talk at our workshop yesterday, and he did an awesome job. And I really appreciate the effort to come all the way from Israel to be part of our conference. Professor Lotan not only is a clinician, but he's an innovator and a teacher as well. So basically, he started his medical training at Hebrew University and Hadassah Medical School in 1979, and then finished his specialization in cardiology in 1987. From there, he's gone on to really be a leader in the field of cardiology in Israel. In 1995, he founded the Israeli Working Group for Interventional Cardiology. He was the Secretary General of that for 4 years. In 1996, he was appointed the Director of Interventional Cardiology and the Cardiac Catheterization Lab at the Hadassah Medical Center, where he still is responsible for this. And this is really an international hospital with an international reputation, and fortunately I was able to visit there a few years ago and was extremely impressed. In 2000, Professor Lotan was appointed the director of the Heart Institute of the Hadassah Medical University Hospital in Jerusalem, where he still has that position today. He also is the chairman of the Ministry of Health Committee for certifications and licensing of coronary stents in Israel. He's been past president of the Israeli Heart Society, and he's just a biomedical innovator on his own right, and has a lot of patents, a lot of ideas, but he's also started an innovation program it's a biodesign program at the Hebrew University in Jerusalem recently. And this is the type of programs that are needed around the world to really educate the next generation of innovators. He showed a little clip of this yesterday at our workshop, and I think he'll share more with us today, this afternoon. These are exciting programs, and they're very time intensive, so someone that's a clinician and an innovator and now setting up these educational programs is really, you have to take your hat off to them and for all their hard work and effort. So it's really with great excitement and enthusiasm that I welcome Professor Lotan this afternoon.
Thank you, Paul. It's really a pleasure and honor for me to be here tonight or today or this afternoon with you in a lovely weather. You know, I was afraid that I'm coming to Minnesota, will freeze to death. It's better than in Jerusalem now. Nevertheless, as Paul mentioned, I'm quite involved in a lot of innovation, and I showed yesterday that the beginning was just because of frustration, having a lot of ideas but not being able to bring them to fruition. And I realized that innovation is like a subspecialty in medicine, and if you don't learn and practice, even though you have good ideas, you may fail, and that's why we started to teach. I will start with the problem of heart disease, as I'm a cardiologist for the last 30 years, and the impact globally is enormous. We know that 1 of 3 people will die out of heart disease and stroke. 17 million people die annually of stroke. Of these, 2.6 million die every day, every year in China. I was in China 2 weeks ago in the CIT meeting. It's a very large meeting, and I was amazed to see the size of the problem in China with the heavy smoker and the habits and everything. So I calculated that every day you have 7,000 Chinese die, which means that during the talk that I gave there were several hundred dying of stroke. But it's also the main killer in the United States. And we do know, for example, that every 29 seconds there is a major cardiac event in this country. So it's still a big problem. And you know, when I was a young fellow, when we started to do streptokinase and TPA to lyse the thrombus, I thought that we ended the problem and we have a solution. But as time is passing, we do know that the problems are getting bigger and bigger, and the needs are large. Coronary heart disease is still playing a very important role with drug-eluting stents. Now we have the new generation of bioabsorbable scaffolds and beyond. The problem of peripheral vascular disease is a big problem as diabetes is becoming a big problem. We have a lot of problem with peripheral vascular disease. Aging of the population is bringing all the problem of valvular heart disease, TAVR, mitral valve replacement, etc. Again, atrial fibrillation and sudden cardiac death are accompanying the population getting older, as well as hypertension and heart failure. And with all the changes that we see here today, the digital revolution, connected health and telemedicine are important. The population is aging, and people want to live better and longer, and it's our duty to find those solutions to help them to do it. Israel, in a way, is a startup nation. If I can get this clip to work.
Israel is, by many measures, the country relative to its population that's done the most to contribute to the technology revolution.
Now, when you look at the NASDAQ, companies are listed from around the world. There's one country, though, that truly stands out, and that is Israel.
If you go to the Middle East looking for oil, you don't need to stop in Israel. But if you go looking for brains, for energy, for integrity, you know, it's the only stop you need to make in the Middle East.
Same time, she has built a nation, transformed an arid wasteland into an agricultural miracle, and evolved into one of the most technologically innovative countries in the world. How did a nation of 7 million manage this transformation? Mayor Brand runs Google's Israel operation.
The foundation of Israel itself could be seen as an entrepreneurial project.
Israel has this intense penchant for constantly questioning and debating and challenging, which is essential for any innovation-based economy.
Dan Senor is co-author of Startup Nation, Israel's Economic Miracle. This talent has fueled more startups than anywhere outside the Silicon Valley.
If you describe Zionism as having a prosperous, strong Jewish state in Israel, obviously the high-tech sector goes hand in hand with that.
So Israel was termed a startup nation, and some of you probably read the book, and if not, it's a recommended one. And it's amazing because Israel is one of the smallest countries in the world with less than thousands of the world's population. And they can claim for a lot of things, as we can see. Most of the Windows NT and XP operating system were developed in Microsoft Israel, Pentium as well. Both the Pentium 4 microprocessor and the Centrino processor were produced in Israel. And as we know, recently, Waze was acquired for over $1 billion. Building this nation also needs some support and resources, and really the government is supporting medical research, and we can see that per capita, Israel has the largest number of medical device patents per million capita. As Paul mentioned, about a decade ago, we started the IGI meeting with the mission of bringing things from idea to reality, and we also started an Academy of Innovation, which is similar to what we've seen yesterday, where people learn from the whole day the essentials of innovations. And as I told you, you can have an idea, but you cannot be an innovator unless you really understand what it is. All of us were inspired by Andreas Grunzig, who had the first coronary angioplasty done in his basement in Zurich. And we learned, and I learned, that the complexity of innovation is large, all the way from the need definition that usually comes from the physician, those people on the bed, but it takes a lot of bioengineering and technology, regulation, venture capital money, patentability, etc. So it's a quite complex thing. As I mentioned, Israel contributes significantly to innovation, especially in the cardiology arena, and I'll try to concentrate on several of the things that we did develop, or some of them are still in the development phase. And you can see all the way from mapping, the pointer is not, okay, from mapping, which was acquired by biosensor to map the ventricle and realize where you have the arrhythmias, the stents which started in Israel, and even the TAVI, transaortic valve replacement, started about 15 years ago as a small company, PVT, in Israel, and later was acquired by Edwards. I'll start with what we call the cath lab of the future. People want to believe, again, an idea that started by a friend of mine, the co-chair of ICI, Rafi BR, and the idea is to have a robotic assisted cath lab where the physician can sit outside and do all what's needed, compared to a physician that has to sit here and bend with a lot of shielding. You can sit leisurely and do it. The question was, can we do it? And the answer today is yes, we can. And there is actually an FDA approval for the first robotic cath lab. And you can see Dr. Giora Weiss sitting leisurely, doing a procedure that's a coronary right, which is occluded. And he slowly manipulates everything. You can have a technician which is in the room that needs to change wire or prepare the stent, but other than that, the physician is all the time outside, and it's a little bit difficult for my generation to be accustomed to that because we are not accustomed to do it remotely, but I think that the young generation of all the children that are playing all those games will be able to do it in the future very successfully, and a lot of procedures and operation will be done in this way. Another interesting thing that started in Israel, and still I'm quite involved, is a way to reduce radiation. We do know that we're standing long hours with radiation shielding, and radiation hazard is a problem. This is a new company that is based on the fact that where you gaze, it will detect your eye movement, and then you'll be able to have radiation only where you look.
Reduces dose to both patients and medical staff during interventional procedures. Employing state-of-the-art techniques, ControlRad delivers the right dose of radiation to the right place at the right time. Using eye-tracking technology, the system is able to know where the doctor is looking on the monitor in real time. With this understanding, radiation can be dramatically reduced in the user's peripheral field of view with no perceivable change in image quality. This is due to the nature of the human visual system, which only allows the appreciation of detail within a limited region of dose to both patients.
I had the opportunity to work with the first prototype, and it's amazing, and additional thing that we didn't even think when we started, because since you see only what you want to see and the rest is a little bit blurred, actually you see better. Another company is Payin, which is helping to place exactly stents or valves exactly where you need to do it. And Synchrorex was recently acquired by an American company, Vulcano, which is helping to do the contours and vessel enhancement, and is helping very much to see much better when you have stents and you have bifurcation and you want to see the stents exactly where they are. Everything is being done automatically. Once you have put your cursor, it will calculate the area, the size, the lesion, etc., without you touching, significantly enhance the image and bring you immediately the results. Another very, very promising Israeli company, very young, but I foresee that they are going to be very successful, is RealView Imaging Technology, which is developing a holographic way to see everything on the air once you do it. So you can see that as an operator, you can play with the heart. This is a holographic image. It's not the real image. It's not the real thing. And you can bring it from CT, X-ray, whatever you want.
Rotated. Prop the hologram to define a desired plane, giving me comprehensive understanding. The hologram to define a desired plane, giving me
So you can, I had to cut very quick, very short AVIs in order to show you everything, but this is an amazing, you can take everything, you can cut, slice, place, rotate, everything on the air. You can take the stents and actually put it and see whether the stents is in the same size, in the same location, everything holographic. First case was done several months ago live during the TCT. Another very innovative company is InspireMD. I'm working with them as the Chief Medical Officer from the very, very beginning. And we do know that embolization is part of the problem. During AMI, you have a lot of material stuff within the artery. Usually it's debris of the plaque and thrombus there. And if you try to open it with a balloon or a stent, you can have distal embolization. The idea here is relatively simple. Take a mesh, like a pantyhose, and put it on the stents with specific size and actually jail the entire thrombus. This came from a case that I did. You can see a right coronary artery with a narrowing here. You know, it was in the middle of the night, and I said to myself, it'll take 2 minutes exactly to open it, since it's a very simple straight. This is the balloon, but as you can see, no flow afterwards. So I opened the artery, there is no flow, the patient collapses, and the simple procedure deteriorated into a catastrophic event, basically due to the fact that the entire thrombus embolized. You can see here, for example, another case of a right coronary artery. You can see after the wire, you can see the distal run, but everything here is a big clot. Knowing that we might run into problems, now we use the M-Guard stent, and you can see that with this stent, the flow is very nice. We are currently in a randomized study in the United States. The first study was a small study, Master 1, that was very successful, showing better ST resolution initially. Now we are at Master 2, which is an FDA-required study to allow this come to the United States. So you can see that some technology are starting there. This actually was heavily invested by American VCs, and actually is now on NASDAQ. Other company is Guardia, and they have, again, embolic protection device, but this time it's a little bit more into the brain. And we do know that the second and big market will be the brain and the stroke. It's becoming a huge market. Again, aging of the population is changing everything, and we have to find a way to fight stroke. Third of the strokes are due to atrial fibrillation and thromboembolization. The rest are in situ stroke, and we have to find a way to deal with all of them. Chronic total occlusion is a major issue, especially if you have arteries that you have an occlusion for a very long period of time. It has been, in the last 10 years, approached by many companies, and we still don't have a good solution to it. I'm engaged with 2 Israeli startup companies. I can't tell you how things are going. We're just going to do the first-in-man soon, but the idea is to have a stabilizing balloon. Usually, when you put the wire and you try to pass the lesion, the wire wouldn't go and you don't have enough support. So the idea was how to find a support, and this is kind of a balloon which is encroaching and giving you enough support to use the wire. This is one company, Endocross, and the other one is NightyLoop. Again, you see a loop of nitinol which opens where you want it to open, very close, and then actually stabilizes the entire system in order to allow you. We've done already several cases. It seems to be interesting. IGI Medical, again, is a company which is trying to coat the stent, this case with pericardium. There is a lot of nobility of how to prepare a thin pericardium, which will give you a pericardial coverage in cases that you need to treat quickly, either dissections or perforation. You can see dissection in the brain, perforation, aneurysm, very good for new application, and they are currently working how to make it smaller and more maneuverable. This is a case of huge aneurysm. In the past, we had to send those patients to surgery when you have a huge aneurysm. This is an aneurysm that was treated with the IGI, and immediately you get a very nice result. Nomask is another interesting idea, and we'll have to see how things are working. The idea was to increase the perfusion pressure in the coronary, and we know that the perfusion pressure is dependent not on the coronary side but also on the venous side. If you increase the venous pressure, then the perfusion pressure will be higher. This is a unique idea which is called the reducer. Usually when we use stent, we want to open and increase. In this case, it's the opposite. We put a stent and we want to decrease the flow in the coronary sinus. By decreasing the flow, we elevate the pressure, and you can see the pressure in the coronary sinus. You can see it in CT, so you have a better perfusion pressure. This is used for patients with heart failure. We have done, that's a friend of mine is finished the first-in-man studies in Germany, and now we are in a follow-up to see whether they are improving with their heart failure symptoms. Endospan is a new company which is trying to tackle the problem of aneurysm, especially in the ascending and arch. We know that ascending and arch vessel, which is called type 1 aneurysm and dissection, are the most difficult to treat. Usually today you have ways to treat aneurysm in the abdominal side, but once it's in the arch vessel, you have problem because you have the big arteries going, and they were able to find a way using 2 axes, both from the subclavian and from below, to devise a stent which will be responsible for the ascending, descending, and the arch. It seems a little bit complex, but I have one of my fellows in the cath lab that is their medical advisor and was able to do it in a pig in about less than an hour, and we are just at the position of finalizing everything for first-in-man. As I told you, the valve started in Israel. It was actually an idea that came from the United States. Several physicians ended up looking for VC support, and they found a small Israeli company that said, we are willing to support you, but we want to build it here, and it was built in Caesarea, Israel. That was the first Sapien at 1995, and about 2002 it was acquired by Edwards and now became the leading stent. On the same premises, there is another Israeli company, again with another friend of mine, that is developing a solution for the mitral valve. There are a lot of companies working now in the mitral area. Some of them are trying to repair the valve. I think there are 5 or 6 in the repair, very difficult to tackle. Some of them are trying to replace the valve. This is one of them, and they are building a mitral bioprosthesis. You can see or barely see the stages. I can see it better on the computer. Here it's a little bit hazy, but there are several stages that you can put in. This is a very successful pig that had implantation about a month ago, a little bit more. And the first in men, or actually 2 cases, were performed about 2 weeks ago in Canada. They have their very large center that is doing a lot of valvular, and they have very successful. I do know that Edwards has a similar design, and I do believe that in the next year or so we'll see 2 companies at least starting first in man with mitral. But as I mentioned, we have a lot of companies dealing with some kind of mitral repair. Valtech is one of them, trying to have percutaneous annuloplasty, and you can see the animals and long term after it looks like. This is one company. Second company is Valker, and again you can see how it's supposed to be placed percutaneously around the valve with suturing, and the idea is to have everything transcatheter. And the third company, which is called Mitrosist, is dealing with problem in the mitral valve, trying to assist the existing valve, if you have asymmetrical leaflet or whatever, to elongate them. So Mitrosist actually trying to elongate the valve, coming with some solution. It's not for everyone, just specific cases. Still in the valve arena, we have Power Square that are trying to develop a better way to open aortic calcified valve. You see a regular balloon. This is opening with nitinol, gives you a much more focused force. You can see an opening in a cadaver with the regular valvuloplasty balloon, and this is after opening with this. Of course, we have the challenges of calcification and embolization, but we do believe that in some cases in which TAVI is not suitable, if we do get reasonable results, especially in very elderly or patients with extreme morbidity, Alzheimer, kidney disease, or whatever, that are not suitable for valve, this procedure, with achieving good results, might give them several good months. Still in the same arena, if we come with a valve, we have to get out of the body, and the closure devices is a huge market. I always tell my students that when I started to do interventional cardiology 30 years ago, I knew that after I finished the procedure, I have to push on the groin for half an hour. That's the way that you know the patient. After the procedure, you talk to him, because you have a lot of time to talk. And unless you sit on the groin for 30 minutes, you didn't finish the procedure. The young generation came and said, well, we don't have the 30 minutes. We have to find some closure devices. And within a decade, it became a market of about 10 billion, just closure devices for everything. We have all kinds of closure devices that you want to think of, thrombin, etc., precious. This Insil is a new Israeli company that has a unique idea, as you will see in a second. So the idea is that you go in and you have a closure device, which you will see. This is the sheath coming into the artery. This is the closure device, which is a nitinol wrapped by PTFE. You push out the nitinol and it will open, and the PTFE will immediately close it. As you can see here around. The good thing that the success is very high and it occludes any size every time. The bad thing is it's an implant, so the FDA regulation are much more difficult, and they are running into FDA studies currently. There are some other startup Israeli in the transapical area. We do know that if you want to go in patient in which you don't have a good access through the femoral vein arteries, or especially in the mitral arena, the mitral valve is very large, it's very difficult to go through the groin, and transapical is going to be probably the only way. We have at least 3 companies looking at different ways to do it in a nice way. Novogate is one of them, actually an idea that is coming from a surgeon. He said that he's going to imitate the purse ring that they're doing in surgery, but the purse ring is going to be out of nitinol. When it's open, it opens like this. When you take out the sheath, nitinol comes back, grabs the hole and occludes it like a purse ring, and they have done several very successful animal study. You don't have to do it through and through. The needles are only 3-4 millimeters, so it doesn't go through the entire ventricle, so you get very nice results without having all the other problems. As I mentioned, we have several other companies working on the same, and one company is actually working that retrogradely, which means that the cardiologist could do it by himself. You put a catheter in the left ventricle, you aim into the apex, you put a hole, and you go through the ventricle outside, and they have done already first in man in Germany. That's another company that is working on catheter apical access. It's called Cardio Apex, and you can see the device, and it's like a plug. Unfortunately, you don't see it here too because of the light, but it's like a plug that once you finish, you plug the left ventricle and you get an immediate success. As I mentioned, the brain is becoming a very important organ, and a lot of cardiologists and vascular interventionalists are involved today in the brain, and a lot of technologies that we learn from the heart and the periphery are now adopted in the brain. And one of the companies, Keystone Heart, is trying to build up some solution to protect patients during interventional procedure where the risk of embolization is high, like in TAVI. We know that the risk in TAVI is about 2%, and 2% is very high to end up a procedure with a large vascular event. And this is a nice device with a mesh that you can easily put in, protects all 3 vessels, and can be retrieved immediately at the end of the procedure. They just finished several patients. They're going to modify a little bit the device, and hopefully we'll get a CE mark soon with this device. The idea is to think about similar devices that are maybe not retrievable in patients that are prone to embolization, like atrial fibrillation, and cannot get anticoagulants. Renal artery and treating hypertension was a very hot in Israel, even before Ardian was acquired by Medtronic, but definitely thereafter the market was very hot. I guess worldwide there were more than 70 companies dealing with it. Unfortunately, after Simplicity 3, the study that showed that might not be an advantage, things are cooling down. But this is one Israeli company that are using ultrasound. The idea is that the depth of penetration of ultrasound is much higher than you do achieve With RF, we're talking about 3 to 4 millimeter. With ultrasound waves, we can get up to 6, 7, and 8 millimeters. And most of the nerves are situated probably deeper in the tissue, and at least the initial animal results that we got were very successful. We're supposed to start our first-in-man in my hospital about the week that Medtronic came with the notification, so the IRB is waiting a little bit, and we'll have to see what will be with this study. But definitely the results and the pathology results are very good. Another big arena that is still open to a lot of innovation is the heart failure. Again, aging the population, a lot of MI. We do know that patients deteriorate, and every hospitalization brings the deterioration of the patient. And we have a handful of companies dealing with different devices, and I'll show you just one or two of them. IGI Medical takes radar technology from the army, and one of the good things in Israel that you can take a lot of technology that are coming from the army, like you have technologies here that are coming from NASA, and trying to bring them into medicine. And here they can directly and accurately measure thoracic fluid up to the level of 5 cc's. So you can really very nicely monitor a patient, and you have a device which is called a patch, which is on the patient, or you can have an implantable, and patient can monitor closely, send the information to the physician, and then handle it. Heart failure is also known to cause sympathetic imbalance between the sympathetic and the parasympathetic. We do know that the parasympathetic is like the brake that is holding the sympathetics. And the question is, should we only treat the sympathetic arm with medication, with beta blockers or whatever, or can we stimulate the parasympathetic and maybe get similar results? We do have an Israeli company, CardioFit, which has developed a pacemaker and a unique way to stimulate the parasympathetic vagal nerve. Initial results are very interesting. Another problem is diastolic dysfunction. People are aging, the heart is getting thicker, less compliance, and a lot of patients are treated for diastolic dysfunction, namely they have shortness of breath, weakness, not to the fact that they have problem in contraction, but rather problem in relaxation. The idea of this innovative company initially was to implant some screws and clips to see whether you can, quote unquote, borrow some energy during systole and then open the heart better during diastole. And this is the way they were doing it in animal models, and the idea, you have springs that collapses during systole, and then the energy that you gain can be used during diastole. This, the way it looks in the implantation, you have to do it in a lot of places. Very complex, and it was just for the proof of concept. Now they are working on a completely different concept that will be percutaneous, that you can see that hopefully you'll be able to implant something during systole, and as you'll see, during diastole, it will give you back the energy. So it will improve the compliance during diastole. This is the idea behind Core Assist, and they are still in the developing phase. Another idea, again, started by a cardiologist, and you can see that a lot of the ideas and designs are started by the medical people that know the needs and then translated into devices by bioengineer, is R-Wave. This is a physician that is involved in heart failure, and he said that if we have a patient with acute decompensation, maybe we can shunt some of the blood from the left atrium to the right atrium, decrease the pressure in the left atrium, and you know that the pressure in the left atrium is responsible for the venous congestion and everything. So if you acutely reduce the pressure in the left atrium, you reduce the pressure. So the idea was to put a shunt, but you want the shunt to be temporary. You don't want the blood to be shunted all the time. So the idea is to create a valve which will depend upon pressure. If the pressure is too high, it opens. If the pressure is reduced less than whatever, it will be closed. Again, very successful animal studies, and it's about to start first in men, in patient in whom you have acute episode of exacerbation that are leading to pulmonary edema. You have a lot of ideas, a lot of designs, so you have to think how to bring it to the community, especially to physicians. We have 2 companies in Israel that are dealing with simulation. One of them is Symbionic, which is very successful. You can plan the entire procedure. You can rehearse on the patient, so you bring the real data from your own patient, X-ray, CT, MRI, angio. You can rehearse in practice and see how it works. This is the simulation model. You bring all the things to the studio, and you can rehearse how things, and even operation, you can see, you can take a tissue, and you can rehearse. This is laparoscopic work, everything done on rehearsal. And Symbionics today have been able to create simulator for valve implantation, for comprehensive and very complex procedure in the cath lab, etc.
How about all that waiting around?
The other thing that I wanted to come is the digital revolution. And this is a Japanese guy, actually American guy, that is talking about medicine in the future. And I think his talk is really changing the way we're going to think about medicine in the future. So
How about all that waiting around just to see your doctor?
In the future, you'll go to the wall screen and say, mirror, mirror on the wall. I want to talk to my doctor now. Immediately, a holographic image will emerge, and perhaps it'll be a software program that can answer 98% of all common problems.
By the year 2060, we will no longer be a slave to fashion. Instead, fashion will be a slave to us, with clothing acting as our first line of defense in an emergency situation.
Your clothes will monitor your heartbeat, recognize an emergency, upload your entire medical history onto the web, alert the ambulances, locate your body by GPS, and alert all the authorities about your situation even before they arrive.
How about all that waiting?
We see that in the healthcare blog, it's written technology will replace 80% of docs. Well, I'm not sure that it will be 80%, and I'm not sure that I'll be there. But nevertheless, I do believe that this will be important thing to be done, not only because it's simple and it's smart, but it's also the need. I just came from China several weeks ago, and I talked to a colleague of mine, Chinese physician, and he's working in a small hospital of about 6,000 beds, and he told me that currently they have about 8.5 minutes per patient. They have more than 1 million patient visits a year, and they are predicted in 2 or 3 years to have about 6 minutes per patient. So if they don't have those technologies that will enable them to shorten the time with the patient, there'll be a problem. So I think that the digital revolution is here to stay. There are a lot of questions about how to do it, what's the regulatory, what's the reimbursement, who is going to pay, etc., etc. But I think that the need is there, and those solutions will be found, and there are a lot of Israeli companies which are dealing with this. For the sake of time, I didn't want to bring all of them, but you have those who are tracking, training, nutrition, everything. In every subject you can find, especially in the chronic disease and in asthma and in diabetes, you have a lot of companies that are supporting the patient, measuring exactly how many pills he's taking, what is the reply, immediately reporting to the physician, etc., etc. And as you can see, monitoring will be important in a lot of diseases: heart failure, post-myocardial infarction, arrhythmias, atrial fibrillation, diabetes, hypertension, COPD, chronic obstructive pulmonary disease. All those patients needs to be monitored, and you can see that today the sensors are very small, and I'm engaged in a company that is monitoring left atrial pressure by injector a sensor which is the tip of the needle, and that can be in a very simple procedure percutaneously, and you have a continuous measurement of what's going on. So definitely monitoring and censoring patient will be very important. There is a startup company in Israel that is doing it together with a Chinese company that is LifeWatch, and they have sophisticated medical sensor. You have a regular cellular phone, but on the cellular phone you can find everything. You can find blood saturation, thermometer, oxygen, high blood pressure, glucose, everything. The entire cellular phone is surrounded by different sensors, even your mood. And honestly, I tried it, and I found all the time that I'm nervous. And it tells you that if you're beyond a certain level, immediately it plays music to calm you down. It's very difficult not to believe. So you can check your body fat, heart rate, stress level, etc., etc. And I think more and more of this will become available. We do know that Samsung, the new generation, is also getting into it, and I think that in the future, companies that are producing the cell phone together with the app will provide. Again, IGI Medical, as I mentioned to you, is developing these sensors, which are the little sensor which are reporting the digital to give you an alert of the amount of fluid, and you can alert the physician of everything. Basically, the entire healthcare cycle is going to be digital, and you have a lot of stations. You have the drugs, you have the healthcare provider, you have the mobile cellular, and you have the patient with all the sensors, and you have the physician in the middle that needs to get all the information. You have a lot of stations and how to coordinate, cooperate, integrate, bring all the information. You need a lot of thinking and a lot of startups, and I think that in Israel in the past we have the IT pathway and we have the medical pathway. Now slowly they are bridging together, because a lot of the IT people are trying to understand what are the unmet needs in medicine and vice versa. So just to summarize, I want to mention that where there is a will, there is a way. Taking your president, yes, we can. So I think that if you really want, you can find a solution, whatever the solution is there, always thinking out of the box. And I invite all of you to our IGI meeting, which will take place in December this year, learning about the unmet needs. The theme of the meeting is the unmet needs. We believe that we as physicians, scientists, technicians, companies should sit together and think, what are the problems? What are really the unmet needs? Thank you very much.
Thank you for that wonderful talk. We can take a few questions, if there are any questions in the audience. Everybody's stunned by all that new technology. Good questions? Yep, couple. All right, we got a couple people. Yep, right here. There's a mic button, I think.
So when you take a look at a smartphone, I'll get right to the specific question. Who is going to integrate all of that information? You're at a university. Are we going to have to retrain everyone to be able to understand all the blood glucose, all of the nervousness and the music that is being played out of this. What is going to happen with all that information from the phone? Who's going to integrate it and get the information back to the patient? Or are the patients actually going to have to understand that information?
You know, it's a good question, and usually when I say it's a good question, it means that I don't have an answer. And this is the case, and I think that we'll have to learn as we go. You know, I was in China several weeks ago, as I mentioned, and I saw there that every traffic light, you have 10 cameras. So I calculated that they have probably in Shanghai 1 billion cameras. So I asked my friend, who is taking all the information? How do you deal with all the information? So he said, we don't deal with it. Only when we need it. So if you have an accident or you have something or whatever. So I think that we'll have to teach the computers to alert us only at certain level. Definitely the amount of data that we are getting is beyond our ability to swallow it. But on the other hand, I believe that we'll be able to have enough intellectual smartness in the computer that will tell us this is okay, we don't need the data, they can be dormant, and in this case, you have to know. Now, definitely, it will take some changes. It will take some changes of teaching in university, teaching doctors, FDA, and regulations. I can tell you that every week when I'm coming to the clinic, I'm bothered. We have a clinic of pacemakers. Usually the average age is 80 to 90 years old. Those elderly patients are coming every 6 months to check the pacemaker. Usually they cannot come on themselves, so they have to bring their son or daughter or the Filipino guys that is treating them. They have to take a cab. You think about the energy and the time that is wasted. For a 5-minute check, put the magnet and see that the battery is okay. I asked several times, can't we do it at home? Just take those miserable patients, think about the amount of money that is spent, billions, to bring them into the hospital, their time, physician's time. Everyone says yes, but what will be the reimbursement? So, you know, the scheme of reimbursement is if you sit with the patient, you're getting paid. If the phone is at home and he speaks with the patient, no one pays for it. So we'll have to re-educate ourselves. We'll have to get reimbursement for such checkups that are doing annually, and that can be done in a second at home. You can even program everything trans-telephonic. So you have a lot of security issues, a lot of problems caused by lawyers. What will be if you have a mistake, like you have now? So I think we have a lot of hurdles, but it's unavoidable with the amount of changes, knowledge, growth of population, and the amount of sensors that we need to sense what's going on with the patient. You know, a baby that is born today is probably going to live more than 100 years. People say 100, 120, I don't know. Definitely, a lot of the organs will fail. You'll have to monitor them. There is no way that you will be able to monitor everything at a regular office visit. And I'm sure we'll find a way. And your creative people here help us to find the ways.
Thank you very much for a lovely talk. But, you know, Israel has taught the world that the startup nation is not by itself in the world. And in fact, we see startups in every city. Every university now has a center for intellectual property and the development of it. And startup companies are everywhere. So Israel has a lot of competition, obviously. Is that being impacted in what's happening in Israel, the fact that the rest of the world has learned to compete and to the startup process vis-a-vis IP, vis-a-vis processes and conflicts. Are we seeing increasing intercompany startup companies starting to be on the top of each other? There must be something like that going on, given the fact of the explosive process of this.
As a physician, I don't see it as a problem. I see it as an advantage. The better we are able to treat our patient, no matter how, is better. At this stage, I think that the world is arising, and I can tell you that since we started the ICI, now everywhere we see it, and I was invited to China, to Russia, to Brazil to present the idea. Because basically, you ask yourself, why don't you have more startup? So I think it's a kind of an atmosphere that brings you to the idea of startup. I am sure that you have innovators all over the world. Why some of them are getting more mature or less mature is the milieu around it. And I think that in Israel, we have a good milieu to nourish it and to have the startup, at least to the level that they can become companies, and most of them actually end up in the United States. But I'll be very happy that it'll be a global thing. I think that we are more directed to startup and needs in the Western world. I think that we kind of neglected half of the world, which is the eastern part of the world. You know, being in India, being in China, you see a lot of unmet needs that we do not pay attention. You know, we had in one of our ICI a team working around the table that you had yesterday, and we had a woman physician from India, and she wanted to have a mitral clip to open actually mitral stenosis due to rheumatic fever. And I said, why do you need it? I mean, I didn't see rheumatic fever in Israel for maybe 20 years. She said, that's the most common thing that we have, and we don't have a good device in India. So we do not really understand a lot of the unmet needs. And India is $1.5 billion, China is $1.5 billion, Brazil, Argentina. So startup concentrated only in the Western world. I think we have to think today globally.
Any more questions? Yep, one more, and then we'll right back here.
As this evolves, then, like with your music example, we'll be sending or having the computer automatically send the treatment to us. Like your music is a treatment for your being nervous. Is that where you see things going? And if it is, could we make it a requirement that we could turn this device off?
Well, I think that we underestimated the strength of the digital revolution. You know, I heard a talk by a friend of mine, Peter Fitzgerald, who is a very smart cardiologist in the Silicon Valley, and he calculated that in the world you have 2.8 billion people with a cell phone and only 2 million people with a toothbrush. So cell phone is much more popular than the toothbrush, not talking about computer and iPad, etc., etc. So you can reach remote places in China, in other places, in Africa, with a cell phone, and maybe you'll be able to provide some kind of medication. But even if it's not a direct medication, even if you have a very high blood pressure or problem, and an alert is being sent to whoever it needs to be sent, or the prescription is being sent to your pharmacy and then from your pharmacy to you, that will be a major thing. So I think that the cellular digital revolution in medicine will be very important in the entire chain. Physician-patient relationship, payer relationship, companies relationship, everything.
So we have a gift for you.
Oh.
We would like to all thank you once again for this wonderful presentation.
Thank you. it's real honor and pleasure. Just a few minutes ago, I had a mail from the director of the hospital. We have some financial problem in the hospital, like regular, and I told him, you know, I'm going to deliver a lecture in front of 700 people, and I feel a little bit shy. He said, good luck. So good luck to you too.
All right. And for those that don't know, Heritage Hall